The cost of prescription drugs in the United States has long been a subject of intense debate and concern. Compared to many other developed countries, Americans pay significantly higher prices for medications, sometimes hundreds or even thousands of dollars more for the same drug. This disparity has serious consequences for individuals, families, healthcare providers, insurers, and the broader economy. The question arises, what if the U.S. government decided to impose a strict limit on the maximum price pharmaceutical companies can charge for drugs? What would be the potential benefits, drawbacks, and ripple effects of such a policy? How would it impact patients, the pharmaceutical industry, innovation, healthcare costs, and the economy as a whole? In this video, we will explore this complex and timely issue in great depth. We will analyze the historical context of drug pricing in the United States, review the current landscape, consider the mechanisms through which price caps could be implemented, and evaluate the potential short-term and long-term consequences of price regulation. The goal is to understand the multifaceted implications of government intervention in drug pricing, an area where health, economics, ethics, and politics intersect. To start, it's important to understand why drug prices in the United States are so high compared to other nations. One key factor is the U.S. healthcare system itself, which relies heavily on market-driven mechanisms, private insurers, and patent protections that grant companies temporary monopolies. Unlike many countries with centralized healthcare systems that negotiate drug prices directly with manufacturers, the U.S. government has historically been limited in its ability to regulate drug costs, particularly for Medicare, the largest public insurer. Pharmaceutical companies argue that high prices reflect the substantial costs and risk associated with drug research and development. Developing a new drug can take over a decade and cost billions of dollars, with a high rate of failure. Patents and exclusivity periods allow companies to recoup their investments by charging premium prices before generic competition emerges. However, critics contend that the prices are often inflated beyond reasonable costs, that some companies engage in anti-competitive practices, and that high prices create significant barriers to access for patients. Many Americans face financial hardship or even forego necessary medications due to cost, leading to worse health outcomes and increased overall healthcare spending. Against this backdrop, proposals to cap or limit drug prices have gained momentum in political and public discourse. Several models exist for how such limits might be structured. For example, price caps could be based on international reference pricing, benchmarking U.S. prices to the average cost in other countries. Alternatively, maximum prices could be linked to the actual production cost plus a reasonable profit margin. The government could impose annual limits on price increases to prevent sudden spikes. Implementing a maximum drug price would require strong regulatory authority and mechanisms for enforcement. It might involve coordination with the Food and Drug Administration, FDA, the Centers for Medicare and Medicaid Services, CMS, and possibly new governmental agencies or advisory panels specializing in drug pricing. Let's consider the potential immediate impacts of such a policy. For consumers, lower drug prices would enhance affordability, improve medication adherence, and potentially lead to better health outcomes. Individuals with chronic conditions requiring expensive drugs, such as diabetes, cancer, or autoimmune diseases, would experience relief from financial strain. Healthcare providers might find it easier to prescribe the best medications without worrying about patients' ability to pay. Insurers, including Medicare and private plans, would see lower drug spending, which could translate into lower premiums and out-of-pocket costs for patients. From a public health perspective, increased access to affordable medications could reduce hospitalizations, emergency visits, and complications, ultimately saving lives and resources. However, the pharmaceutical industry would likely resist such policies strongly. They argue that price controls could reduce revenues, leading to cutbacks in research and development budgets. Reduced profits might slow innovation and the development of new life-saving drugs. The U.S., which has historically been a global leader in pharmaceutical innovation, might lose its competitive edge. Additionally, companies might respond by limiting the availability of certain drugs in the U.S. market, or increasing prices in other areas to compensate. There is also the risk that drug shortages could occur if manufacturers find it unprofitable to supply some medicines at capped prices. These concerns highlight the complex balance between making drugs affordable and maintaining incentives for innovation. The policy design would need to address these trade-offs carefully, possibly by providing subsidies, grants, or public funding to support pharmaceutical research alongside price limits. Economically, capping drug prices could significantly reduce overall healthcare spending. Prescription drugs constitute a large and growing portion of healthcare costs in the U.S. By reducing prices, government budgets for Medicare and Medicaid could be stabilized, potentially allowing expansion of coverage or reallocation of funds to other areas of need. Lower drug spending for employers could reduce healthcare premiums and improve competitiveness. Consumers would benefit from reduced out-of-pocket expenses, increasing disposable income and potentially boosting other sectors of the economy. At the same time, the pharmaceutical sector is a major employer and contributor to the U.S. economy. Reduced profits could lead to job losses in manufacturing, research, marketing, and related fields. The ripple effects would extend beyond pharma companies to suppliers, service providers, and local economies dependent on the industry. Internationally, U.S. drug price caps could influence global pharmaceutical markets. The U.S. market is by far the largest and most profitable for many companies. Price limits could lead to changes in how companies price drugs in other countries or negotiate licensing and distribution deals. There is also a geopolitical dimension. U.S. leadership in biomedical innovation strengthens its global influence. Weakening the pharmaceutical sector through price regulation could have unintended consequences for global health diplomacy and technological leadership. On the political front, drug price caps are a highly contentious issue. Many voters express strong support for measures to make medicines more affordable. Politicians from across the spectrum have proposed various reforms. Yet powerful pharmaceutical lobbyists and campaign donors exert significant influence to oppose restrictive pricing policies. Implementing effective price caps would require overcoming entrenched interests, ensuring transparency in pricing and profits, and building broad coalitions among stakeholders including patients, healthcare providers, insurers, and policymakers. Transparency is critical. Currently, the drug pricing system is opaque, with rebates, discounts, and complex pricing arrangements obscuring true costs. Price caps could be coupled with requirements for disclosure of R&D expenses, manufacturing costs, and profit margins to create a fair and accountable system. Another important consideration is equity. Drug price caps would need to ensure that vulnerable populations, such as low-income patients, the elderly, and those with rare diseases, benefit fully. Tailored policies might be necessary to support access to orphan drugs and specialized therapies without imposing undue burdens. Technology could play a role in monitoring compliance with price caps. Blockchain and data analytics might be employed to track pricing, distribution, and usage patterns, helping regulators enforce limits and prevent circumvention. Moreover, consumer education and advocacy would be essential. Empowering patients with information about drug prices, alternatives, and assistance programs can help maximize the benefits of price regulation. In the long term, government price caps could catalyze changes in how pharmaceutical innovation is funded and rewarded. There may be a shift toward more public-private partnerships, government-sponsored research, and alternative incentive models such as prizes or patent buyouts. The traditional model of recouping R&D costs through high drug prices might evolve into a more balanced approach prioritizing public health goals. Such reforms could increase transparency, reduce wasteful spending on marketing and administrative overhead, and focus investment on truly breakthrough therapies. In summary, limiting maximum drug prices in the United States has the potential to transform healthcare affordability and access. Patients would benefit from lower costs and improved health outcomes. The healthcare system could become more sustainable with reduced spending on medications. However, challenges related to innovation incentives, industry responses, economic impacts, and political feasibility must be addressed. A nuanced, carefully designed approach that balances affordability with continued scientific advancement is crucial. The stakes are high. Millions of Americans struggle with medication costs that limit their ability to manage chronic diseases and live healthy lives. At the same time, the U.S. pharmaceutical sector drives innovation that saves lives globally. Finding a path forward that respects both imperatives is one of the defining policy challenges of our era.